Welcome to the Tucson Unified School District training module on basic diabetic care. Thanks for taking time out of the day to learn more about diabetes and for your commitment to providing an optimal, supportive environment for TUSD students with diabetes. Almost everyone holds a personal link to diabetes through a friend, themselves, or a loved one. Nearly 21 million adults and children in the U.S. have diabetes, including over 100 TUSD students with type 1 diabetes. What exactly is diabetes? Diabetes is a chronic illness in which the body either does not produce insulin at all, known as type 1 diabetes, or does not produce enough insulin and does not properly use the insulin produced, leading to a deficiency, known as type 2 diabetes. Insulin is vital for everyday life because it converts sugar, starches, and other food into energy. Diabetes is the 6th deadliest disease in the US, and no known cure exists. Type 1 diabetes occurs when the pancreas does not produce insulin. Patients with type 1 diabetes often require multiple doses of insulin every day from a shot or an insulin pump. Type 1 diabetes accounts for 5 to 10% of all cases of diabetes, and it's the most prevalent type of diabetes among children and adolescents. Type 1 diabetes cannot be prevented. Type 2 diabetes occurs when the pancreas does not produce enough insulin or does not use insulin produced properly. What used to be thought of as an old person disease is now a problem for youth as well. There has been an increase in type 2 diagnoses among children and adolescents in the US. Specifically, African Americans and Hispanic or Latino Americans are at a higher risk for type 2 diabetes. When diagnosed early, people can often manage type 2 diabetes with lifestyle changes, such as improved nutrition choices and portion sizes, as well as physical activity in addition to oral medication or insulin shots. This disease can often be delayed or prevented. Type 1, on the other hand, cannot be prevented and therefore has nothing to do with lifestyle choices. Gestational diabetes occurs when a pregnant woman with no history of diabetes develops high blood sugar or glucose levels during pregnancy. Hormones related to pregnancy block the action of the mother's insulin. Gestational diabetes usually occurs late in pregnancy and results in high glucose levels in mother and baby, requiring treatment. Accurate and early diagnosis of diabetes is imperative. Possible long-term complications can occur at any time, especially if blood sugar levels are not controlled. These complications can be deadly in both type 1 and type 2 diabetes. Some of these complications include heart disease, stroke, kidney disease, blindness, nerve disease, amputations, and impotence. As school personnel, you are part of a team, led by the school nurse, to care for children with diabetes. Your prompt response to symptoms can play a major role in the prevention of short and long-term complications. You will also help to ensure that your students with diabetes can maximize learning and academic performance. Symptoms of type 1 diabetes include frequent urination, excessive thirst, extreme hunger, dramatic weight loss, irritability, weakness, fatigue, nausea, and vomiting. These symptoms usually occur suddenly and can be deadly if not treated within a matter of days. Type 2 diabetes symptoms include increased thirst, frequent or nighttime urination, blurry vision, unusual fatigue, and dark skin around the neck or armpits. These symptoms usually occur over time and may go unnoticed, especially if the child doesn't immediately share the changes he or she is feeling, such as frequent urination or blurry vision. The symptom that is most noticeable in type 2 diabetes is dark skin around the neck or armpits. If you notice a student going to the bathroom frequently or unusually thirsty, you should notify the parent or guardian and/or school nurse, as school personnel can be the key in early diagnosis. Diabetes management is a 24/7 task, but every child is different. Some students can provide self-care, others will need help from school staff. Each student will have his or her own target blood glucose range that you should know. Insulin, some diabetes medications, and exercise drive blood sugar levels down. Food raises blood sugar levels. Diabetes management requires a constant balance between insulin and medication, physical activity, and food intake in order to keep blood sugars within a student's target range. The ability of a student to provide his or her own self-care is dependent upon the student's level of ability, how long he or she has had diabetes, and his or her willingness to provide self-care. Many elementary school age kids can do their own finger pricks. By the time most students reach middle school, they are able to give their own injections or master their own insulin pump boluses. Some students, the younger and perhaps less experienced, may need help with some diabetes care tasks. Some may be able to do their own finger sticks while needing an adult to administer insulin. All students with diabetes, regardless of self-care skill level, will need help in the event of emergency. For example, severe hypoglycemia, where a student passes out, has seizures, or cannot swallow, will require a trained adult to give glucagon, if ordered by the student's physician. Become familiar with your student's individual low and high symptoms and know who to contact for help. There are three most immediate concerns in managing type 1 diabetes that you need to be aware of. The first two are hypoglycemia, or low blood glucose, and hyperglycemia, or high blood glucose. Those can occur multiple times each day. The third issue, ketoacidosis, happens infrequently but can be deadly. Ketoacidosis is when ketone acid builds up in blood because there is not enough insulin in the body. Hypoglycemia, or low blood sugar, is one of the most frequent complications of diabetes and can happen very suddenly. It occurs when a student's blood sugar level falls too low, usually due to administering too much insulin or not enough food to match insulin given. It can also occur when the student is skipping or delaying meals or snacks, not eating enough food, or exercising longer or harder than anticipated. For some students, it is more likely to occur before lunch, at the end of the school day, or during or after physical education class. Never leave a student alone if he or she is experiencing hypoglycemia. Treat or seek help immediately. Hypoglycemia, which sometimes cannot be prevented, is the greatest immediate danger to students with diabetes. Hypoglycemia can impair cognition and sometimes can be mistaken for misbehavior. If a student has a sudden change in behavior, becomes lethargic, combative, confused, irritable, or unconscious, or is having a seizure or convulsion, presume the student has hypoglycemia and treat the situation as a hypoglycemic emergency. The appropriate response is to first give the students a quick-acting sugar equivalent to 15 grams of carbohydrate. Some examples include 4 ounces of unsweetened juice, half a can of regular soda, or 3 to 4 glucose tablets. Ask a parent or guardian to provide you with what works best for their child. Next, check the blood glucose or BG level to 10 to 15 minutes after. Last, repeat the treatment if the BG level is still below the student's target range. Never leave a student alone if he or she is experiencing hypoglycemia. It is important to immediately seek help or treat hypoglycemia on the spot wherever your student happens to be, whether it be in a classroom, playground, or an assembly, field trip, or the gym. Do not delay treatment. If in doubt, treat as hypoglycemia. Recheck his or her blood sugar level 10 to 15 minutes after treatment to ensure the blood sugar levels are on the rise. Parents will usually provide you with a low box containing their child's preferred quick-acting sugar product. Be sure to keep this quick-acting sugar with you whenever your class and the child are out of the classroom. Before you run out of the supply, alert the parents or guardians to send more. These are some of the common symptoms of hypoglycemia. Symptoms for each student may differ. One student may experience shakiness, while another student complains of feeling tired and weak. Talk with parents or guardians and your school nurse to know what to look for in your student. Be prepared to treat a low blood sugar with juice, regular soda, glucose tabs, or another quick-acting carbohydrate provided by parents or guardians. Severe hypoglycemia is rare at school and generally can be prevented with prompt treatment when the early signs of low blood sugar are recognized. It is important that you know your student's low blood sugar symptoms so severe low blood sugar can be avoided. It is also important that you know how to reach the person at your school who is trained to administer glucagon in the event that your student experiences severe hypoglycemia. Glucagon is a hormone that raises blood glucose levels caused by the release of glycogen from the liver. It cannot harm your student. If the student becomes unconscious or experiences convulsions or seizures, position them on their side to prevent choking. Your student may feel sick to his or her stomach or vomit when he or she wakes up. Your student's parent or guardian should supply the school with a glucagon emergency kit. When a student is experiencing severe hypoglycemia, the school nurse or other trained person must respond immediately. Your school nurse and other trained personnel should know where the kit is kept and have ready access at all times. If you are not glucagon trained, then contact your school nurse or other trained person who will administer glucagon. While glucagon is being administered, another school staff member should be calling 911 and the student's parents or guardians. Hyperglycemia, or high blood sugar, is another frequent complication of diabetes and can happen very suddenly. It occurs when a student's blood sugar level is above his or her target range. Hyperglycemia can be caused by not enough insulin, illness, infection, injury, stress, decreased exercises, or a combination of factors. Check with your school nurse and parents or guardians to find out what signs and symptoms your student might exhibit if he or she has high blood sugar. High blood sugar can cause increased urination, so provide free access to bathroom needs. High blood sugar also causes increases in thirst, so the student may need to use the water fountain or have access to water or sugar-free beverages. Many times, students will need extra insulin to treat high blood sugar. For students who are able to provide self-care, they may want to administer their insulin in the classroom. Others may prefer privacy. Become familiar with your student's symptoms of hyperglycemia. Some students will run to the bathroom more frequently. Others may complain of fuzzy vision. Hyperglycemia can impact cognition and concentration. Your understanding and support can make all the difference in the health and outlook of your student. Encourage self-care, but don't draw attention to a student performing a fingerstick blood sugar check. Make sure diabetes supplies and snacks are accessible to the student. Students should carry a quick-acting form of carbohydrate to treat low blood sugar. You may also want to ask a parent or guardian to give you some glucose tabs or juice boxes to keep at your desk. Make sure students eat snacks on time, and perhaps set a timer if your student needs a gentle reminder. If a student misses classroom time or an exam, or if his or her cognition is impacted by lows or highs, give extra time to make up missed work, tests, and other assignments. Make sure you understand which classroom accommodations, if any, are required and what you need to do to ensure compliance with your student's 504 and healthcare plans. Some other classroom tips for diabetes management at school include keeping a contact sheet of trained diabetes staff handy for emergencies. You can also create a diabetes info sheet for any substitute teachers you may have. Learn signs and responses to low or high blood sugar levels. Allow blood glucose monitoring and free access to bathrooms or the drinking fountain during class. Teach your class about diabetes. And finally, let parents or guardians know in advance changes to the class schedule, such as field trips or special events, so they can plan ahead. For more information, you can visit www.diabetes.org/schools and www.diabetes.org/safe@school, where you can also download the following free tools: the NDEP's Helping the Student with Diabetes Succeed, a guide for school personnel, and the ADA's Diabetes Care Tasks at School, what key personnel should know. You can also visit www.diabetes.org/schoolwalk for free lesson plans about diabetes. The more we know about diabetes, the better position we will be in to support our students and help them grow and mature to achieve maximum academic success. Thank you for taking the time to complete this training on basic diabetic care. Congratulations! You have completed the video portion of this training module. Now, head to topic number 2 and pass the quiz with an 80% or higher to receive credit for taking this course.